Okay, we're going to finish the bovine. We had one disease which did not finish, bovine leukemia virus.
Dr.
Yes.
So in our Blackboard, the points for the reviews are...
We'll answer this later. Okay, so bovine leukemia virus, the name will somehow give you the impression that this is the animals have leukemia. In fact, the evidence that they have leukemia is scarce, meaning that that's not consistent. This is why when you go to Merck Veterinary Manual, what you see, if you type bovine leukemia virus, it will come under bovine leukosis. So bovine leukosis, which is indicative proliferation of leukocytes, in this case, basically lymphocytes. This occurs in dairy cattle, and it's a significant economic issue in dairy cattle due to the presence of lymphosarcomas, which are spread in several organs. The disease is transmitted through infected cells. Milk can transmit the disease, contaminate the blood, and there is some evidence that insects may be involved as well. So the pathology basically is multicentric lymphosarcoma involving lymphocytes. Although not all animals develop the multicentric lymphosarcoma, only 1 to 5%. So that means the others may have the infection, but not necessarily developing the sarcomas, the lymphosarcoma. Now this is a retrovirus. Knowing retroviruses meaning that sometimes they can cause the disease, and other time they can become silent for a significant amount of time. So this is a disease of adult cattle. Like most retroviral infections, it takes time to cause the disease. The natural host are cattle and water buffalo. Now, 30% of the animals develop lymphocytosis, persistent lymphocytosis. So what you have is basically a replication of cells, of lymphocytes in large numbers, present in blood circulation as well as in different organs. Now, as I said, this is a disease of older age, 4 to 8 years of age, and the main pathology is lymphosarcoma, present in different places, in the heart, in the intestine, lymph nodes, and other places where lymphocytes, particularly B lymphocytes, are present. When it comes, this is showing the lymphosarcomas in the heart muscle, and showing it in the neoplastic growth, representing lymphosarcomas also in the intestine, among other organs. So the primary target is B lymphocytes. However, other cells can be infected by the virus, like monocytes and macrophages, which make things in a way worse. So as I said, some of the animals develop the cancers, not all animals, and that's due to basically mutations of the virus resulting in a strain or in a variant of the virus that can cause the lymphosarcoma. Now, when it comes to diagnosis, one can detect this, if you want, disease can generate a very strong antibody response, in the same way like FIV. So ELISA for antibodies can be used in this case. However, there is cell culture assay, which is called the syncytium inhibition assay. So basically, this virus causes the production or the appearance of syncytium, fusion of cells into a giant cell. Because of that property has been exploited to test antibodies that are present against the virus in the patient. So those antibodies are incubated with the virus and cell culture. If syncytium is not being produced, that's an indication that those patients have antibodies against the virus and then they are infected. If they produce, if there is no antibody, then they would not inhibit the virus, and the virus can then infect the cell lines and produce a cytopathic effect, which is in this case the presence of syncytium. Other assays, PCR can be used, like in some cases of retroviruses. If the virus DNA got incorporated or integrated in the host genome, then you can look for the proviral DNA. In this case, in lymphocytes which are affected. As I said, the animals that produce robust immune response, which is good for diagnostic purposes. The virus can only be eliminated by removing animals which are infected. But as we know, being a retrovirus, these animals will be infected for life. Vaccination, like in most retroviral virus or retroviral vaccines, they're really effective because of the many variants that can be produced. Okay. Any questions in relation to bovine leukemia virus? Okay, let's finish some of the equine diseases. I think we reach here. Okay, this is a very important disease. It causes a number of pathologies. It causes respiratory infection. It causes abortion, neonatal death, and neurological symptoms. The neurological symptoms are pretty characteristic of this disease among other diseases in equine that cause neurological symptoms. The reason for this is not only the presence of vasculitis, but also the presence of hemorrhage in the spinal cord. The presence of hemorrhage is characteristic of this disease, which is equine herpes 1, virus 1. Now the other name of this disease is equine abortion virus, and this is basic because basically that's the if you want the main presentation of the disease. However, this virus can cause also respiratory disease and encephalomyelitis. So abortion, because of the importance of abortion, now the abortion is not coming from bulls. It's not coming, from sires. Okay, thank you. So it's not coming from a semen, infected semen. This is a systemic disease. This is a disease that may initially is respiratory and then becomes systemic, spreading to other parts of the other organs of the animals and infecting the fetus and causing the abortion. So the virus enters the respiratory system. Once it enters the respiratory system, it infects the dendritics. It goes to the lymph nodes. In the lymph nodes, it initiates, if you want, it replicates and then enter the blood circulation. Once it enters the blood circulations, it can spread to other parts of the animal including infecting the fetus, causing abortion. Now, the abortion has two presentation, one which is sporadic abortion and one which is abortion storm. Basically, at the initial stages, there is a sporadic abortion. Once this is a spread, because that's a respiratory infection, it can spread quickly and can cause abortion storm. The encephalomyelitis it occurs following entrance of the virus into the CNS. The clinical signs as a result of this are the usual clinical signs with any which follow encephalomyelitis, basically ranging from mild ataxia to paralysis and eventually recumbency, and may lead to death because of the hemorrhages in the brain. What happened to the fetus? This virus causes severe lesions in the fetus. And actually the lesions are spread in many parts of the fetus. If the abortion occurs later in the gestation, then there is no autolysis. Autolysis occurs if the abortion occurs at the beginning or in the early phases of the gestational period. As I said, the lesions in the fetus are really severe, ranging from splenomegaly to liver, liver infection, necrosis in lymphoid follicles, and others. If we look also microscopy in all these in those stated organs, there is widespread necrosis. In looking at in the case of encephalomyelitis, what we find is vasculitis, infection of the vascular endothelium, and hemorrhage, which is characteristic of those lesions in the spinal cord. For diagnostic purposes, there are various assays that can be used. The virus can produce antibodies, and the virus, as we said, is present in the circulation and the fetus. So there are various places where samples can be taken, and various techniques can be used. But what's important in the diagnosis is the differential diagnosis, because that has to be differentiated from equine herpes 4, which also causes abortion, although the abortion is sporadic, usually in equine herpes 4. In terms of vaccination, there are vaccines, both attenuated and inactivated. Generally speaking, when it comes to attenuated vaccine, we don't give them to pregnant animals. The attenuated vaccine can be given to before coitus, to about 1 month before coitus, to animals that will become pregnant later on. And in terms of hygiene and in terms of management control, obviously, because this is a respiratory disease, the animals should be separated. Those are affected from non-affected, and also those that are they had abortion because the virus is present in the aborted fetus. Now this is another herpes. This is equine herpes 3. So we saw equine herpes 1. This is equine herpes 3. Equine herpes 3 causes ulceration in the genital, both the female and the male. It starts with vesicles, become pustules, opens up, ulcerate, becomes ulcers, And those ulcers then later on, they heal and they leave behind them white depigmentation of the skin. Now this white depigmentation is an indication of that those animals are carriers for the virus. Although they do not shed the virus, but it's for screening purposes, it's important to know that those animals have been infected and may be dealt with, so that they do not, for example, mate with males later on. Yes?
You said the white discharge is an indication of the herpes virus itself or herpes virus?
It's not discharge, white depigmentation, depigmentation, so of the skin. Okay? So basically this virus infects the genitals, the vulva, and the part of the vagina, as well as in the male, the penis. So as a result of this, what's going to happen, particularly if the males have those lesions, is that is going to be painful for the males to mate, making the breeding program an issue in those animals. So again, it starts as pustules, ulcerate, and then it is on the vagina and vesicular mucosa. The lesion adjacent also on the adjacent perineal skin of affected mare or the penis and prepuce of affected stallions, they are present. And once the mares, once those lesions are healed, they leave afterwards white depigmentation, which is indicative that those animals are carriers. Now, when it comes to diagnosis, the white depigmentation is important because that's indicative of those animals are carrier. Although it's not known how the disease or how the infection is transmitted from those mares to other animals. And it's not known whether mating with these mares can spread the infection to the males. What happens to the males is that the viability of their sperms become reduced, significantly reduced. And the reason for this is because of the ulcers presence on the penis. Once they bleed, at the time of ejaculation, the blood mixes with the sperm and reducing their viability. One can do, for diagnostic purposes, EM for the virus, and in relation to differential diagnosis, it should be differentiated from herpes 1 and herpes 4. Treatment, basically local antibiotics, and there is no vaccine available for this disease. Another herpes, a third one, which is equine herpes 4. So we need to know the differences between 1, 3, and 4. And those come in the NAVLI. So this is, the other name of this disease is equine rhinopneumonitis virus. So it's basically a respiratory disease. It can cause a sporadic abortion, not like equine herpes 1, which is at initial stages sporadic, but later on it can be, it can cause abortion stone. So this is easy disease when it comes to clinical signs, because basically it is a respiratory disease. So you have the discharge, nasal discharges, which if they are complicated by bacterial infection become mucopurulent. It's a disease of falls over 2 months old, in relation to vaccine, there are vaccines which include equid herpes 1 and 4. Because of the similarities of these viruses, it can be given to protect against equine herpes 4. Now, the reason we're saying equine 1, herpes 1, 3, and 4, and ignoring all the others, not because the others are not important, like 6, 8, and 9, but because those affects usually wild horses rather than domesticated horses. Very important 3 diseases which are very much related to each other and all of them cause encephalitis. It's called equine encephalitis viruses, and those are spread by mosquitoes, transmitted by the virus is transmitted by mosquitoes, and causes severe encephalitis in horses. These diseases are endemic in the Americas. They are 3 diseases: Eastern equine encephalitis virus, Western equine encephalitis virus, and Venezuelan equine encephalitis virus. So, as I said, they are related, and the region they're called Eastern, Western, and Venezuelan is due to the primary location when they were found, but they can be present in various regions.